Hi, it's Dr. William. I just wanted to point out a couple of things here. I'm with a patient who's 1 month post-op from her abdominoplasty, also known as a tummy tuck, and she's done very well. She still has a little bit of redness around the belly button because it's still an inflammatory stage, and her scar is also red as well. That's totally normal. And she has a little bit of puckering of the skin here. This may be a dog ear. Most likely it won't be a dog ear, but at this 1 month stage, it kind of looks like there's a little something there. But I suspect over the course of a year that this will just kind of shrink down. But the interesting thing here, what I really want to talk about is that so she did the tummy tuck first, which is what I recommend because it basically, you'll see from her preoperative photo, she just wasn't a good liposuction patient. So we got rid of the skin, and now she is a very good liposuction patient if she chooses to do that, and she will do that in the next year. And we're gonna wait 6 months between liposuction and her tummy tuck. And the reason why is we want the blood supply to her abdomen to get really strong and firm, because when I do the tummy tuck, we make the incision here and we lift everything up, that disturbs the blood supply. All the little blood vessels that come down here off of this little major artery and one of the arteries here, we have to cut those as we go through in order to be able to lift the skin. So now this skin is relying on blood supply coming in from the sides. So we wait for that blood supply to get nice and strong, and then it's safe to go back in and do liposuction. Here we're 1 month out. If we did liposuction right now, we could potentially create areas of ischemia here. So that's the reason number one for waiting. And some people, we do this together. We'll do the tummy tuck and the lipo together. And we could have done that in her situation, but it is optimal if you can stage them, because now when we go back in 6 months, she looks like she's nice and flat because she really doesn't have a significant amount of internal fat, but she does have some fat still on the outside. So now when we go back and the blood supply is reestablished 6 months later, then we can go through and we can lipo her abdomen, we can make her abdomen even flatter. But the real benefit, I'm just gonna have you turn just a little bit here, just a little bit more. The real advantage is going to be that we're going to be able to lipo not just the front, but we're going to be able to lipo her whole back and the sides. And I lipo through this key area. My lipo comes all the way down here. So all of this will disappear, and she has a naturally good waist, and she has a decent collection of fat here and a decent collection of fat here. So when we do this lipo and we bring that waist in and we get rid of the fat in the flank and the key area, that will round her butt, she'll have a completely different shape. Not only will she have a flatter tummy because of the lipo here, but she's also gonna have a totally different shape. And a lot of times people will ask me, oh, when you're doing your tummy, is that gonna really cinch everything in? Well, it does to a certain degree, but not the same amount that lipo can do. So the reason why a tummy tuck will naturally bring the waist in a little bit is because of what we call the muscle plication or the muscle repair, where we're correcting the rectus diastasis. That's that separation of the abdominal muscles, and we're bringing those muscles together. That will help to bring the waist in, but it's not going to bring the waist in to the same degree as the liposuction will. So when I lipo through this area and all through here and get rid of all of this fat, that will really bring the waist in, and that will give her her shape. So the way I look at doing this in a staged manner is the first operation is we're just getting rid of the skin, we're giving her a new belly button, we're tightening the abdominal muscles, but the real shape change comes 6 months later when we do the liposuction. And we can transfer to the gluteal area, that's a BBL if she wants, or we don't have to. But that's one advantage of staging the operations, meaning doing the tummy tuck first, and 6 months later we do the liposuction. Essentially, we're taking somebody with excess skin who's not a good candidate for liposuction because they're going to have loose, wrinkly skin here, and we're converting them into a very good patient for liposuction because now there's no skin problem, there's no excess skin, so we can get a nice flat abdomen and we can get a really good shape to her body.